27.1. Complete a table with words from A and B opposite. Noun: absent, diminution, flaccidity, spasticity, wasting. Adjective: absent, diminution, flaccid, spastic, and wasted. 27.2. A doctor is giving instruction to a patients during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. I like you to relax. I'm just going to move your arms up and down, muscle tone. 2. Can I see your hands? Muscle, bull, and possibly involuntary movement. 3. Now I am going to straighten your arms out. Try to stop me, power. 4. Can you touch my finger with your arm, then touch your nose? Good. Now do it again with your eyes closed. Coordination. 27.3. Complete a sentence. Look at A and B and C opposite and at the table in 27.1 above to help you. 1. A flaccid hand draws lively to form a right angle with the wrist. 2. Brisk reflex up reflex that are stronger than normal. 3. Muscle weighting means the muscle in the reduce in bulk. 4. A tick is a form of involuntary movement. 5. A key is often used to test the Babinski-Plampfer response. 6. His coordination was poor. He could not perform rapid alternative movement. 7. A tendon reflex hammer is used to test reflex. 8. When something is dimensioned, it is less than normal. 27.4. A patient is brought to A&E in coma. When her name is spoken, she opened her eyes, but she does not answer question or obey instruction. What is her GCS score? GCS 5. Eyes opening to speech. Respond nouns. Over to use sample and square jack jerk, bicep jerk, tricep jerk, supinator or wrist jerk, knee jerk, ankle jerk. Diagnosis: the patient has Parkinson's disease.